Did you know that over 70% of adults over 60 experience unexplained itching, and in some cases, it could be an early warning sign of cancer? Imagine feeling an itch that won't go away. No rash, no dryness, nothing that typical creams or lotions can fix. For many seniors, this quiet symptom is often ignored until it's too late. Are you or a loved one experiencing strange, persistent itching in unusual spots? What if that itch was your body's way of sending a secret distress signal about your health? In today's video, we're going to reveal 5 very specific places on the body where itching could mean more than just dry skin, sometimes appearing months before any other cancer symptoms. You'll discover the hidden reasons behind these mysterious itches, the types of cancer linked to them, and the crucial signs that tell you when it's time to see a doctor. This isn't about fear, it's about knowledge, awareness, and empowerment. Because catching these signs early can save lives. If you're ready to protect yourself or someone you care about, hit that like button, comment "I'm watching" below, and let's learn together. Don't scroll away. Your health could depend on what you're about to hear. Let's begin. Persistent itching on the lower legs. Persistent itching on the lower legs, especially without rash or dryness, can be an early sign of serious blood-related cancers like lymphoma. Many seniors often ignore this itch, thinking it's just aging skin or a minor irritation. However, when the itch lasts for weeks, worsens at night, and does not improve with lotions or creams, it deserves attention. Cancers such as Hodgkin's lymphoma affect the lymphatic system, an important part of the immune system. As cancer cells grow, they release inflammatory chemicals into the bloodstream. These chemicals cause a deep burning itch in the lower limbs. Although the skin looks normal, nerves beneath the surface become irritated, causing discomfort. George, a 75-year-old man, shared his experience during a cancer awareness event. For 6 months, his only symptom was a persistent itch on the fronts of his legs. Initially, his doctor suspected eczema or a reaction to detergent. However, blood tests showed abnormal white blood cell levels, and further scans revealed swollen lymph nodes in his chest. That itch was the earliest warning sign before any other symptoms appeared. The itching usually comes with no rash, no changes in soap or lotion, and worsens especially at night. It often occurs alongside other silent symptoms such as fatigue, night sweats, or unexplained weight loss. Older adults should be especially alert to these signs. To support circulation and ease discomfort, seniors can keep their skin moisturized, stay hydrated, and maintain a diet rich in antioxidants from fruits and vegetables. Gentle leg exercises like walking or stretching also help improve blood flow. People on blood-thinning medications should consult their healthcare provider before trying new remedies for itching. Persistent itch without explanation deserves a thorough medical check to rule out serious causes. Have you or someone you know experienced stubborn leg itching like this? What steps did you take? Share your story in the comments below to help others recognize these important warning signs. Itching between the shoulder blades or upper back. Itching that occurs deep between the shoulder blades or in the upper back region can sometimes be more than just dry skin or irritation. For many seniors, persistent itching in this area without any visible rash or skin changes could be an early warning sign of pancreatic cancer. This kind of itch is often ignored or mistaken for something minor like poor posture, dry air, or irritation from clothing or shirt tags. However, when the itching is constant, intense, and does not respond to lotions or moisturizing creams, it's important to consider more serious underlying causes. Pancreatic tumors can block the bile ducts, which are tubes that carry bile from the liver to the intestines. When bile flow is slowed or stopped, bile salts accumulate in the bloodstream. These excess bile salts irritate nerve endings, especially in the upper back area, where there is a dense network of sensory nerves. This irritation causes the deep nagging itch that is sometimes the first symptom of pancreatic cancer. Linda, a 70-year-old woman, experienced a persistent phantom-like itch on her upper back for several months. She tried everything from lotions to back scratchers, even changing her mattress, but nothing relieved the sensation. Blood tests showed elevated liver enzymes, prompting her doctors to perform imaging scans. These revealed a small tumor pressing on her bile duct. Remarkably, the persistent itch was the only symptom Linda had before any pain or digestive issues appeared. This early warning gave her a better chance to receive timely treatment. If the itch gets worse and is accompanied by other signs such as dark urine, pale stools, yellowing of the skin or eyes, or unexplained fatigue, it is critical to seek medical advice immediately. To help maintain healthy skin and reduce discomfort, seniors should drink plenty of water. Eat a balanced diet rich in fruits and vegetables and stay physically active with gentle exercises like walking or stretching. Ignoring this kind of persistent itching could delay diagnosis and treatment of a serious condition. If you notice this symptom, don't hesitate to consult your doctor and mention the pattern and intensity of your itch. Have you or a loved one experienced this type of deep, stubborn itching on the upper back? What actions did you take? Share your experience in the comments below to help raise awareness and support others. Itchy scalp without visible flakes or dandruff. Many seniors experience occasional scalp itchiness, often blaming dry air, aging skin, or shampoo changes. However, persistent itching of the scalp without visible flakes, redness, or dandruff can be an early warning sign of more serious conditions such as blood-related cancers like leukemia or skin cancers affecting the scalp. This type of itch feels different from ordinary scalp dryness. It often presents as a tingling, crawling, or burning sensation that may move from spot to spot. Unlike normal irritation, it does not respond to anti-dandruff shampoos or moisturizing oils. For people over 60, such sensations can indicate nerve irritation caused by abnormal immune activity when leukemia cells multiply and affect the body's inflammation regulation. Henry, a 73-year-old man, noticed his scalp itching every afternoon. He changed hair products and even stopped wearing hats, but the itching persisted. After a full blood panel for unrelated fatigue, doctors found abnormally high white blood cell counts. A bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. His scalp itch was the first and only symptom that alerted him. This type of itch can easily be mistaken for normal dryness or sensitivity, especially in older adults. However, the key difference is its persistence and resistance to treatment. No creams or shampoos soothe it. It nags constantly and often seems disconnected from any visible scalp condition. In some cases, skin cancers develop on the scalp, especially where hair thins. These cancers may start as small itchy patches that look like dry skin or minor bumps. If itching persists in the same spot without relief, it is important to have the area checked by a dermatologist. Since the scalp is hard to examine personally, ask a trusted person like a spouse, caregiver, or hairdresser to check your scalp regularly for any unusual patches. If you experience an itch that doesn't improve over weeks and doesn't respond to treatments, and if you feel more tired, bruise easily, or feel generally unwell, don't ignore these signs. These subtle symptoms can be the body's way of signaling an underlying problem. To support scalp and overall health, maintain a balanced diet, stay hydrated, and manage stress. If diagnosed, follow your doctor's guidance for treatment. Have you or someone you know had persistent scalp itching like this? What steps did you take? Sharing your story can help others recognize these important early signs. Localized itching on the chest or breast area. Persistent itching on the chest or breast area, especially around the nipple or just beneath the breast, can be more than just skin irritation or sweat. For many older adults, this type of localized itch could be a warning sign of inflammatory breast cancer or other tumors near the chest wall. This kind of itch is often overlooked or mistaken for common causes like tight clothing, skin thinning due to aging, or reaction to detergents. However, when the itching is focused in one spot and does not improve with moisturizing creams or changes in clothing, it should raise concern. Inflammatory breast cancer is aggressive and can show symptoms before a lump appears. The skin may feel warm, irritated, or tight. Sometimes it may have a rough or reddish appearance. In some cases, the skin looks normal, but the itch remains persistent and unrelenting. Ruth, a 69-year-old woman, noticed a constant itching sensation on her right breast. She tried changing her bras and detergents, even went without a bra for a while to reduce friction. Despite her efforts, the itching continued every day in the same spot. Upon examination, her doctor found slight skin dimpling and ordered further tests. The diagnosis was a small but aggressive tumor growing close to the skin surface without the typical lump. This is why inflammatory breast cancer can be so dangerous. It doesn't always present the usual signs. Men can also experience breast cancer, although it's rare. Symptoms like an itchy patch near the nipple, thickened skin, or persistent discomfort beneath the chest muscle should not be ignored. Men often miss these signs because they don't expect breast cancer. Additionally, itching in this area can be caused by enlarged lymph nodes under the arms or near the collarbone. This can indicate lymphoma or other nearby cancers. If the itch comes with swelling, warmth, or a heavy feeling, seek medical advice promptly. Early detection starts with awareness. If you notice persistent itching on your chest or breast that doesn't respond to usual care, see a healthcare provider for a proper evaluation. To support skin health and overall well-being, maintain a balanced diet, avoid tight clothing, and stay active. Regular self-examinations and medical checkups are crucial. Have you or someone you know experienced this type of persistent chest or breast itching? What did you do? Sharing your experience may help others recognize early signs and seek help sooner. Persistent itching in the anal or genital area. Persistent itching in the anal or genital area is an uncomfortable and often ignored symptom, especially among older adults. Many people may dismiss it as a minor irritation caused by hygiene issues, infections, or sensitivity to products. However, when this itching becomes chronic and does not improve with usual treatments, it may be an early warning sign of serious conditions such as anal vulvar or penile cancer. This type of itch is tricky because it often masquerades as a minor nuisance. People might assume it's dry skin, a reaction to toilet paper friction from walking, or even related to incontinence products. In many cases, these are valid reasons. But when the itching persists for weeks or months, returns despite thorough cleaning and moisturizing, and feels more raw or burning than surface level, it demands medical attention. Eugene, 76, dealt with what he thought was hemorrhoid irritation for nearly a year. Despite using creams and dietary changes, the itching never fully resolved. A colorectal specialist eventually performed a scope examination and discovered a small lesion on the anal canal wall. That lesion was an early-stage tumor silently growing. Vulvar cancer is less common but becomes more frequent in women after age 60. One of its earliest signs is persistent itching on or near the outer genital area. This itching may not come with visible lumps, but can be accompanied by skin changes such as roughness, discoloration, or thinning. Many older women attribute genital itching to hormonal changes or postmenopausal dryness, which can be true. However, if the itching is relentless, worsens at night, and does not respond to usual remedies, it could signal a more serious issue. The genital area has many nerve endings and is highly sensitive. This means it often shows symptoms of internal problems early. Chronic itching on one side or focused in a small area can indicate nerve inflammation, skin changes, or swollen nearby lymph nodes, all potential red flags for cancer. Unfortunately, many hesitate to talk about itching in this region due to embarrassment or fear of overreacting. But silence can delay diagnosis and treatment. If you or someone you care about experiences this kind of persistent itching, please seek medical evaluation. Early detection greatly improves outcomes and peace of mind. Maintaining good hygiene, avoiding irritants, and regular medical checkups are important. If diagnosed, follow your healthcare provider's treatment plan closely. Have you experienced persistent anal or genital itching that didn't go away? What was your experience? Sharing your story might help others take early action. Thank you for spending time with us today. Your health matters, and sometimes the smallest signs like a persistent itch can tell the biggest stories. If you're over 60, listening carefully to your body and acting early can change your life. You hold the power to catch problems before they grow. Don't wait or ignore what your body is trying to say. Take control now. Talk openly with your doctor. Ask questions. Demand the tests you deserve. You're not alone. We're here to support you every step of the way. Please share your story or questions in the comments. Your experience might be the lifeline someone else needs. If you found this video helpful, please hit the like button, share it with your loved ones, and subscribe to our channel for weekly tips that keep you informed and empowered. Remember, your health journey is yours to lead, and every step forward is a victory. Stay strong, stay aware, and we'll see you in the next video.